Welcome, and thank you once again for spending a few minutes to get an update on what's happening at FHN through our community videos. This week, I'm very pleased to be able to introduce Dr. Rebecca Pedersen, who is not only our Chief Quality Officer, but is also a primary care physician at Highland View Drive. In fact, Dr. Pedersen is my primary care physician and my family's primary care physician, and she always has great advice for us on how to stay well and to keep healthy. And this week, she's going to be sharing some of that advice for you as it pertains to COVID-19. So thank you for joining us.
In the clinic, we don't see very many patients because we're triaging them to our acute respiratory clinic if they have symptoms. The most sick patients would come to our emergency department and be admitted. Fortunately, we have not seen the uptick that we were prepared for after Christmas. We thank you, community members, for following the rules set forth by our government that said limit large family gatherings. Don't get together for some of these celebrations. Wear your mask, social distance, because it's really made a difference. We were expecting more capacity, more people in our hospital, and they didn't arrive. So we're thankful for that. We're able to take care of the ones that are here, and we have plenty of staff to do so. We track this based on data that is gathered from our region, and on average, 6 to 10% of people with a COVID diagnosis will be hospitalized. So many of you are able to stay at home, manage your symptoms with over-the-counter medicine, maybe a few supplements or some prescription medicines that your provider gives you, and just a small percentage need our help in the hospital. We're thankful for that. The recommendation is for you to stay isolated from others for at least 2 weeks. If I was living in a house with you, that means that we would have separate bedrooms. We would wear masks if we were within 6 feet of each other. We'd use separate utensils. We would try to keep a distance so that your infection didn't become my infection. This has worked excellent. We've seen families that have only had one sick family member, and even though they live in the same house with their children or their spouse, the rest of them stayed healthy because they respected each other's distances, they put boundaries, and they kept their germs to themselves. Most patients will say, this is a pretty bad cold. I have a runny nose, I might lose my sense of smell or taste, so I just don't feel like eating, and I just want to lay around. I'm just exhausted and very tired. If they have a cough, it's typically a dry cough. It could have some chest pain associated with it, and they do have generalized aches and pains. Some people have some other unusual symptoms, neurological symptoms, such as visual disturbances, numbness, tingling. I can't concentrate. I'm not thinking quite straight. Of course, if your symptoms are severe and you can't breathe, you're confused, you're just not acting your usual self, you should come to the emergency department for care and evaluation. So over-the-counter medicines, such as Tylenol, could be used for your aches and pains. Your provider will probably recommend some vitamins and supplements that you could use to boost your immune system. Drinking plenty of water, tea, things for hydration that would soothe your sore throat. Making sure that you're eating at least 3 small meals a day to keep up your nutritional status. It just takes a little bit of rest and time and soothing yourself with common remedies that our moms would have used for us. Hot baths, chicken noodle soup, and a lot of love. Symptoms typically last 2 to 3 weeks, and during that time you just have to be patient with yourself. So we talk about a little bit of love. That just means being sympathetic with others who have symptoms that last longer. Some folks are now called long haulers. That means that they didn't recover in the typical 2 to 3 weeks of time that we expected. They may have lingering symptoms that keep them out of work, keep them out of the community, and they just don't feel well. So we want to be empathetic for those people and realize that everyone recovers at their own speed. Typically, it starts with a phone call to your provider. You may say, my husband has COVID and I have these symptoms. We'll do a screening questionnaire with you and decide if you need to stay at home, use some over-the-counter remedies, or if you should be seen at FHN's Acute Respiratory Clinic. This is a clinic we established across the street from the hospital. It is where we send people with respiratory symptoms to keep them safe in one location away from other healthy people that might be at our clinics. What you've done so far has been working. We've actually had improvement in our infection rates. Our governor has released some of the restrictions, and that just means you need to continue doing what you've done. Be respectful of social distances. Wear your mask. If you're sick, stay home. Even if you have to miss work, miss school, miss community events, have empathy for others who aren't feeling well and who might need a little extra attention or checking in on. And above all, be true to your neighbor, just like you're true to yourself, and be respectful. Masks do work. COVID is real.
I'm pleased to share that over the past 2 weeks, we have not seen an uptick or a surge in any way, but we've still been averaging over 10 patients a day, between 10 and the mid-teens over the past 2 weeks. We still do have patients that are battling for life on ventilators, and that's something that, even though is a lower number, is still a significant concern for all of us, as well as a very sad case that we have seen several deaths over the past few weeks that are related to COVID-19 and the symptoms that those have driven to untimely outcomes. So it's one of those things that, even though things are definitely getting better and much more controllable, at least these past few weeks, it's still a significant concern for all of us in this community. I'm very pleased to be able to enjoy the fact that we've moved into phase 4 and we're out of these tiered mitigations from the state of Illinois, and look forward to continuing to make progress so that we can really get this pandemic under control. While not everybody at FHN has been vaccinated now or just yet, we do have well over the half or the majority of our staff that have received their initial vaccinations. And in fact, we also have a vaccination clinic coming up just a couple of days after the filming of this video to try and vaccinate some other members of our staff to keep that number moving up. And we hope that within the next few weeks, we will have, again, the great majority of our staff vaccinated with their second dose, so completely immunized for COVID-19. We have had staff experience some side effects after becoming vaccinated. Some of the common side effects have been mild and usually resolved within 24 hours. However, we have had some staff that have had significant fatigue, some headaches, some chills, and just a general uncomfortableness. And while those symptoms are certainly not fun, they are pale in comparison to the severity of contracting a full-blown case of COVID-19 and being hospitalized or worse. So in comparison, it's one of those things where the vaccines have been relatively mild. We have not had significant medical concerns that have required life-saving emergency treatment during the vaccination, as you might hear in some of the media stories, and we're grateful for that. Yet again, at the same time, there are some side effects when receiving vaccinations, and that's something that people should plan ahead for. As the vaccine situation continues to ebb and flow dependent upon the supply, I am glad to be able to share that we are in phase 1B in Illinois, which invites people who are 65 years or older, as well as those with significant qualifying chronic conditions and frontline essential industries that can now be vaccinated. So work is continuing that rollout. We have completed what was phase 1A. That phase 1A included our healthcare workers, long-term care residents, also first responders, law enforcement, and those individuals. So we're now in that phase 1B, and when we move into the phase beyond that is really going to depend on the timing of how quickly we can get individuals vaccinated, and of course how much vaccine we'll be able to get or be supplied by our local health departments. The inconsistent vaccine availability, I wish I had a clear answer on that, but it's a number of different factors that come into play, like with any large-scale logistics or supply chain challenges and the ability to manufacture, produce, and distribute the vaccines in a time that is in such high demand, not just locally, but across the world. And it's a demand that we haven't seen for a particular product or need in the recent past. And I think that creates some of the challenges with being able to have that steady flow. So once there's any disruption, that really has a domino type of effect. But we do know that it is becoming more consistent and it's being produced at a greater rate than ever in our recent history. Mass vaccination events may work well in large urban areas where there's National Guard troops and there's lots of support to be able to have that. What we are looking at doing at FHN is partnering with our Stevenson County Health Department and other local health departments in being able to set up these vaccination events. And we'll be providing that information available via our social media channels, our website, as well as a lot of our traditional media, so stay tuned for that. Our plan is to really focus on trying to do those vaccination clinics by appointment, and we want to do it that way to be able to make sure that they're not only efficient, but also that we're upholding safety as we get people through that vaccination process and moving people through as efficiently as possible. When we were hosting some of our vaccination clinics here at FHN, we were able to vaccinate at a rate of 1 person per minute, which was pretty good. A lot of the paperwork and pre-work had been done, but we were able to move people through those vaccination clinics very efficiently. We will also be asking people to wait for a period of at least 15 minutes just to make sure that everything is okay. So there are a lot of logistics that are surrounding being able to host those vaccination clinics. I'd like to start by saying thank you to all of the families and individuals through Northwest Illinois. This has been a trying time for all of us, and your patience is greatly appreciated. Know that we are committed to delivering healthcare excellence to you and your families, and we're doing everything that we can to help keep you safe, and we do appreciate all of the actions that you're taking for your own health and for the health of others and keeping them safe. So I would ask folks to continue to do the great work that they're doing, to be patient, to move through these phases as we recover and move out of this pandemic wisely so that we can avoid a resurgence or an uptick. And let's enjoy all that our community has to offer. I'd always put a call out there for us to support local whenever possible so that we can help our neighbors, our friends, and our families as we get through another winter in 2021.